on our YouTube channel. We will also be sending out an evaluation survey at the end of the event. If you could take the time to complete that, that would be great, because it just gives us a bit more understanding about what we can do to improve them, and if you've got any suggestions. We are going to have a Q&A section at the end of the presentation, and my colleague Oscar will be facilitating that. So if you do have any questions, please pop them in the chat box and we can pick those up. If you don't want to ask in the main chat, you can message me directly privately if you wish, and I can pass that over anonymously for you. So today we're with Migraine and Self-Management with Ria Bhola, a headache nurse specialist within the Migraine Trust, and I'll pass it over to you, Ria.
Thank you very much, Steph, and thank you very much to everyone who has joined us. I hope it will be helpful to some of you, at least some aspects of it. We will be talking about migraine self-management. So why do we need to think about self-management, firstly? So it's mainly because, as you all know, medicines are not the full solution to migraine problems. Migraine comes with a whole lot of symptoms and debilitating symptoms at that, and often the medicines are not enough to control the symptoms or to prevent an attack. So we need to look to other measures as well to either supplement the medication treatments or to use instead of. And very often we need to limit medicines because they may interact with some other treatments being used. There are side effects that are often not well tolerated, and medications can, particularly painkillers used in migraine, can lead to medication overuse headache, which is a compounding factor that we try to avoid, because if you develop medication overuse headache, you get this rebound effect where the headache never goes back to zero, and you're left with this residual pain on a near daily basis. So just as a recap, just looking at the stages of migraine, we know that migraine is a condition, first of all, that presents itself with a number of symptoms. It's not just the pain, although the pain phase is the one we mostly recognize, but there are a series of stages, and very often people with migraine tell us that the general public regards migraine as just a headache, but it is so much more. And in order to explain it, it's very helpful to have these recognized stages. It's also helpful because if you recognize the early stages, it helps us to treat earlier or to take measures that could limit how severe the attack becomes. So at the earliest stage, we find premonitory symptoms, and this can happen for a few hours or for a day or two before the pain stage. And these symptoms might be things such as neck stiffness, food cravings, extreme tiredness, feeling irritable, and often we don't put it down to the start of a migraine attack, but they tend to happen at that very early stage. Also passing more urine, some people report. And this tends to precede an aura stage. For about a third of people have aura symptoms with their migraine. And although we have the symptoms as the aura following premonitory, it's useful to note that the symptoms, the stages can overlap. So aura symptoms may occur after premonitory symptoms. And these may be visual changes like partial loss of vision, complete loss of vision, which then resolves completely. Spots in the vision, tingling, numbness, weakness. These might all be aura symptoms. And very often when you go to see a doctor, they're very concerned about how quickly your aura symptoms develop. And typically for migraine aura, it takes about 5 minutes to develop rather than a sudden onset within seconds, which might indicate other things. So the headache phase, which most people are most debilitated by, starts with increasing pain together with other symptoms like the sensitivity to light and noise and sounds, sometimes nausea, sometimes vomiting. A lot of people find pain maybe on one side of the head, but it can be anywhere in the head. And this altered sensitivity where everything is experienced in a more extreme way is very typical of this stage. The following two stages, the resolution and the postdrome, they tend to be, sometimes they are considered as a single stage, but it's when the pain is fading and becoming less severe, and you're left with this drained, tired, sometimes people describe it as a hangover feeling. And it sometimes mirrors the premonitory stage where, for example, if you had increased appetite in the premonitory stage, during the postdrome, this is the opposite. Or if the mood was high in the premonitory stage, it tends to be low in the postdrome. So often concentration is affected, and you never feel fully recovered until you get to the end of that stage. So looking at what our self-management or non-medicine options are, we've got these categories: lifestyle adjustments, which for everyone is advisable because the migraine brain reacts to change, sudden changes in particular. So we often ask patients and people with migraine to aim for regularity in their activities, some of which you cannot control, but for things like sleep, meals, keeping hydrated, when you drink caffeine, whether you have caffeine or not, just keeping them regularly at set times can avoid triggering migraine attacks. For some people, there are known triggers that are quite specific and reliable. If these can be avoided, then that's even better. Sometimes with triggers, though, it takes a few triggers occurring together to tip you over this sort of threshold and develop a migraine attack. So some might be avoided or minimized. It's not always avoidable. We will look at some nutritional supplements that can be helpful to prevent migraine attacks, or at least limit the number or severity. And we will look at some non-invasive devices that may be available to some. So when we think about migraine triggers, many people have different views about this, about which triggers are actually very strong, which affect them more. Some absolutely do not affect them for some attacks, but in other attacks they can be more susceptible. So it's quite an individual impact, these triggers. So at the basis of all of this, we know that migraine is an inherited condition. There is an inherited component to it. So the hereditary baseline, the family history, we believe makes you more susceptible to the other environmental factors that make you more migrainous or develop migraine attacks. And things like, as we already mentioned, the sleep, you may be able to control to some degree. Stress is we're less able to control, but we can mitigate it a little bit by having some strategies to cope with it. Usually smell, lights, and sound become amplified after the attack has started, but for some people they can actually, sufficient exposure can actually trigger an attack. Alcohol is one of those where some people find that a certain amount is tolerable or none at all, and of course they can manage to avoid those. Some foods, for example, foods that contain monosodium glutamate might be a trigger for some people, or certain nitrate compounds. And weather change, which we can't change very much, but stormy, oppressive weather can be a trigger. So it's important to maintain regularity, not skip meals, have regular sleep, manage stress where possible. And for things we cannot control, like hormone levels and the weather, then, you know, we try to minimize the others to avoid, where possible, triggering attacks. With supplements, the top 3 supplements that have good evidence for preventing migraine are the riboflavin, which is vitamin, 400 milligrams per day is the recommended amount, magnesium 600 milligrams, and coenzyme Q10. These are higher doses than you would have recommended for general good nutrition. And there is a belief that it works well in migraine because it produces more energy in cells, which in some way limits the susceptibility to attacks. However, they tend to work better for people who have episodic migraine, meaning the migraines are less frequent, so less than 14 days a month of headache, where 8 of those will be migraine, and, or sorry, not 8 of those, but some of those would be full-blown migraine attacks with all the associated symptoms, but less than 15 days in total in a month. So they tend to work better, but it takes about 3 months to get the full effect, which is similar to medications, which have to be built up in the system. I've included melatonin. Melatonin is a natural hormone that's produced in the body in the presence of darkness. It helps to get us ready to sleep. In some countries, it's promoted as a treatment for jet lag. However, it can be helpful, especially in the short term, for helping with sleep and regularizing sleep patterns. It doesn't, again, work for everyone, and some clinics or GPs will prescribe it, others won't. So, but it may be something to think about. So, for example, if there's an episode or something happening in your life at the time that interrupts sleep, that's unavoidable. For example, someone told me about having surgery recently and being unable to sleep, and having their doctor prescribe a few weeks of melatonin to just regularize that pattern was really helpful. And we know that sleep or lack of sleep can be a migraine trigger. So from that point of view, it can be really helpful. And when we look at neuromodulation devices, neuromodulation refers to a stimulation of certain nerves that are pain sensitive, that feed back into the brain to adapt the sensitivity to develop migraine. So within the brain, during a migraine attack, everything's amplified, sensitivity, and we think that within migraine, there is this altered processing. So the way the brain interprets information coming in is slightly altered. Neuromodulation tries to adapt that and make it more, actually less susceptible to producing migraine attacks in response to changes. So unsurprisingly, devices have been developed to target various nerves on the head and various branches of our trigeminal nerve, which is the pain-sensitive nerve. And some of these are single pulse TMS, transcranial magnetic stimulation, the Cephally device, which is an external trigeminal nerve stimulation device, the TENS, which is transcutaneal electrical nerve stimulation. They are variously placed on parts of the head, forehead, back of the head, for some of the other devices, where they stimulate the nerve. Were designed initially for acute treatment, so when the attack starts, but then later found that the beneficial effect builds up if you can treat preventively, so maybe once or twice a day, whether there is pain or not. And this effect can be very helpful. It has no interaction with medicines. However, the limitation is that they are costly because they're not funded on the NHS, except for maybe the odd 1 or 2 clinics for single pulse TMS. And because they're not available widely in the NHS, there isn't a huge amount of data for us to make a recommendation on who it might be most suitable for and whether one should go out and pay for it. So it's a little bit about personal preference and affordability to try them. The non-invasive vagal nerve stimulator, which is gamma-core, which you may have heard about as well, is used to treat migraine in some countries, but in the UK it's only approved for cluster headache treatment, and for that it works quite well. We know that there are newer options that are developed, newer devices, but they are not yet available in the UK for treatment, and these may include Relivion, Nerivio, Acute, Theragun, and Cordate, some various names you may come across when looking at migraine treatments. If they do become available or NICE approved, we will write more about it and discuss these further on the website. But good to bear in mind that there are good non-drug options as well. The other NICE approved or considered treatment is acupuncture. Again, this is limited because not every clinic or center offers it, but in places that do offer it, GPs can refer for a course of 10 weekly sessions typically. And some people find them very beneficial, particularly during the period of time when they're being treated, so for the 10-week period, which is significant for some people. Others find the benefit inadequate, but it's again something that's worth considering if you're not bothered by needles and if it's accessible, as a good non-drug option to try. And in addition to those options, things that might be helpful would include just using hot or cold packs and trying which is better. Some people alternate hot and cold packs during an attack. So the combination of having heat or cold together with rest or sleep during an attack might be quite a good strategy for some people. Other people find exercise can be helpful, obviously not during the attack because movement can aggravate migraine symptoms, but exercise can produce endorphins, so a regular pattern of exercise. Endorphins can be can help with pain relief. For some people, it can worsen their migraine. So again, it's something to try and see over time whether it's helpful. Relaxation is really important because we cannot often regulate the amount of stress we have in episodes or in daily life, and having factoring in relaxation techniques, exploring these might be a helpful way to manage even during an attack. Cognitive behavioral therapy offers strategies that might help us to contextualize migraine, the condition, and living with migraine, and also during a migraine attack can help us to remember that the attack will come to an end, because very often it feels endless, and there is the fear and anxiety around when it will end, what tasks you're not able to do, how it helps with planning activities when you've got to factor in the difficulty of planning with migraine. So overall, it can be very helpful to help with life and involvement in activities, bearing in mind that migraine can be very disruptive. And then there's the whole body of information about glasses, lighting, and screens that we often find discussed on various platforms and migraine groups. So glasses in general, the thing to say is that when it comes to screens and glasses, there are no strong, convincing evidence that any one type is suitable or most suited to treating migraine or preventing migraine attacks. Some of these take a bit of trial. They work for some people better than others. We know that limiting blue light on screens can be helpful. Limiting the amount of light, so wearing sunglasses on bright days, for example, in particular, can limit exposure where light is a trigger for people. So it's very, and also it's important to make sure that when you work, there is adequate lighting. Natural light is often better where possible, and also looking away from screens at intervals. So, and with sitting with good posture at during screen time can all help to limit attacks and developing migraine attacks, because it sort of is a combination, very often is a combination of the exposure to various elements that helps to limit the number of attacks, and also how severe attacks become. When considering which treatments or strategies to adopt, the acupuncture, the supplements, and the device treatments are worth exploring with your doctor, just to consider whether you may have medical conditions that could be impacted by introducing any of these, and looking at dosing. So if you were using a device treatment, it's good to consult on what's the appropriate dosing and what might be best for you depending on the device. And with the supplements, we have got doses up, but it's whether it's going to interact with existing medications and treatments you're having. With regularity and triggers, as mentioned before, everyone can benefit from having a lifestyle adapted that with some regularity built in to minimize migraine attacks. And exercise, hot and cold packs, relaxation techniques, devices should be explored. They may be more helpful to some than others, and it's only by trying them over a period of time that you discover what's most suitable. And as a reminder with medicines, this talk hasn't been focused on treatments, but for acute treatment, something that comes up very often in clinic is how to best treat acute attacks. And bearing in mind that some of you may be using treatments but not getting sufficient benefit, I thought I'd just mention that treating early is better, but of course, when you're trying to limit how many days you have an acute treatment, this can be a little bit of a balancing act. So referring back to whether there are early signs, for example, premonitory symptoms that might indicate an attack is coming, will help to help your decision-making on taking a treatment early. Triptans like sumatriptan, almotriptan, zolmitriptan, there are 7 triptans. They are recommended for acute treatment. Non-steroidal medicines like aspirin, ibuprofen, naproxen are recommended, and taking those, either of those or both of those together with an anti-nausea medicine like metoclopramide, prochlorperazine, domperidone, in combination works best. However, these drugs are not suitable for everyone. So again, there's caution and limitations with those. But also remembering, if you are able to take them, taking a second dose within the 24 hours works better, because if you treat more aggressively early, you might get rid of an attack on the first day, which then reduces the need for a treatment on subsequent days and shortens the attack. Some nasal formulations like Zomig or sumatriptan nasal spray might work quicker for people whose attacks develop really fast or develop during the night when you haven't had the chance to take a treatment early, and GPs can prescribe those. And so trying different treatments for at least 2 attacks before deciding on the best is a very appropriate way to approach your acute treatments. And again, for everyone, it's really, really helpful to keep a record, for example, in a headache diary, a calendar, an app, or whatever way you choose to record when you have headache or migraines and what treatments are taken. It helps with just being able to compare whether a treatment is helpful when you are using a treatment, comparing it back to your baseline when you didn't have that treatment, or if you're exploring new treatments that are coming along in the future, you might want to compare how you are at present with trying a new treatment, or also to demonstrate to your doctor that you do need to be referred for CBT, or to have acupuncture, or a device treatment, or to be referred on to a clinic if the treatments you've tried with your GP isn't sufficient. And having a record there to help that conversation in the form of a diary can be really helpful. Also, to be able to look at the painkiller days and whether you're becoming increasing the risk of medication overuse complications. So that's most of the information I was going to cover, but I'd like to just draw your attention to our helpline and the information on the website, which you may find helpful, and to also mention that as new treatments come along, we're always updating the information on these, on who they're suitable for, and various approvals from NICE and the SMC. So thank you for your attention, and with that, I'll hand back over to Steph for questions.
Yeah, thanks, Ria. That was really, really useful. We've actually had quite a few questions in by the looks of it, so we may not necessarily be able to get through all of them, but we'll certainly do our best. We apologise if we don't get through to your question, but do send it over to the helpline afterwards so we can get that answered for you as soon as we can. And over to Oscar for the questions.
Hey everyone, hey Ria, thanks very much for that. So I've tried to group them together as much as possible. So the first question is that someone during an attack, they find when they put pressure on the pain site, it actually helps them cope and relieve a bit of the pressure and the pain. Do you know, could you explain why that might be, what the cause of that might be?
Interesting. I'm not sure why it is, but very often people with pain, in various types of pain, body pain, migraine, find that it's like a distraction. When you encourage the body to focus on a new pain, pressure, it sort of limits the amount of pain from the original site. So it's a distraction, really. So the brain doesn't focus on just that one primary pain, the migraine. Perhaps that's how it works.
Yeah, that's really interesting. Thank you. The next question is focusing on sort of screens and lighting and things, and it's asking, do you know if blue light filters work for people with migraine?
Some people do say that blue light filters help, and I think it helps insofar as it enables them to use the screens more and longer. And I guess it's a preventive as well. It blocks out some of the light so the brain isn't overloaded with this sensory input. Does it work for everyone? I'm not sure, because a lot of people come to clinic and still say they've made all of these adjustments and things are still really difficult. So I think overall, these things work when your migraine isn't wound up in such a stage where everything's just severe, or becomes severe quite easily and gets triggered quite easily. So there are probably really good measures to take before things become too difficult to treat and manage.
Yeah, that makes sense. Thank you. We had lots and lots of comments in the chat box about people who experience vertigo during their migraine. It seems to be quite a common problem with people on today. So I don't know if you have any suggestions for that. Obviously, preventative medications were asked if they help, but if you have any other sort of non-drug treatments or other suggestions for people that experience vertigo.
Vertigo is a tricky one because it's quite, it's increasingly recognized, the link between vertigo and migraine, and the vertigo, the dizziness, and those symptoms that occur. Most of the treatments we recommend are medication. Unfortunately, it's because it's so closely linked to the migraines, medications are used to tone down all of that sensitivity. I know that there are some ENT clinics, for example, where physios recommend certain exercises that are specific to control vertigo symptoms. There is some caution to be had with people with migraine because certain movements can aggravate migraine and it may not be suitable. So in general, what we would say to people in clinic is to have a preventive treatment that controls the migraine to a degree that they can tolerate things like exercises for the vertigo symptoms that are left. So it's probably a combination of both that works best.
Okay, thank you. That's great. We've had a few questions on supplements now, so I'll focus on those. So the first one, potentially quite a simple one. Can you or do you take all the supplements you suggested together or not?
You can take them together. Many people do. We don't know if you need all three, but generally people tend to take all three together because of the idea that having a full treatment with any of those, if you tried one of them and actually the other one is more effective for your particular migraine, then you'd have to then spend another 3 months with the other one. So most people, for the convenience, they try all three together to get the best, to give the best chance of a benefit, and take those for 3 months.
Perfect, thank you.
Sorry, I will just say it's
carry on.
worth going for, with magnesium, the ones that are easily absorbable. So those that say magnesium oxide, magnesium citrate, and magnesium chloride tend to be better absorbed than magnesium sulfate or carbonate.
Perfect. You just answered my next question, which was the best types of magnesium. So fantastic. Thank you. Another question around how to access melatonin with supplements, because apparently GPs have refused to prescribe to a few people that have commented. Is this something people can buy? Is there a way people can access this?
Well, yes, I have. Yeah, some GPs aren't comfortable with it because they haven't used it very much, because for a long time it wasn't licensed in the UK. And some people get it online. Some people buy it abroad because it's available over the counter in other countries. However, your GP, if they're not comfortable with it, they could ask for advice and guidance from their local neurologist before prescribing it, if that makes them more comfortable. It would seem inconvenient to have to get a referral from the GP to secondary care and be on a waiting list to get something that the GP could prescribe. And they would know within some weeks if it's going to be helpful. So it's probably better if the GP can consult with the hospital on a phone call and do the prescription. If they're really not comfortable with it, then a referral or to a headache clinic, or alternative means, or a sleep clinic. But it shouldn't be as difficult. I know it is in practice, though.
Yeah, definitely. And the final question about supplements. Someone said that they get hormonal migraines. So would supplements still be suitable for them, considering it's to do with an imbalance of hormones, or is there something else you'd suggest?
Yeah, I think whatever the type of migraine, the reason the same treatments are recommended is these treatments aim at going to the core of migraine, which is within the brain. So if it's hormonally related, if it's vestibular related, it still affects the migraine part of the brain. So these treatments should work. If it triggers migraine, then the treatments aimed at calming down the migraine centers should be effective.
Fab, thank you. A few questions about one question about devices now as well. A few people have made some great suggestions of devices they've tried. So if people are wanting suggestions, maybe have a scroll through the comments. Someone mentioned one I've not heard of, the Zoc Relief device, which is available in the USA. They want to know if you'd heard about that, but also want to know any devices you know that are available on the NHS.
Yeah, I haven't heard of that particular device, no. On the NHS, there are no devices, except I know of one. I've heard of one clinic that had got funding for the single pulse TMS device, a clinic in London, but otherwise the devices need to be funded, so you need to be paid for individually. The TMS, the Kefli device doesn't need a doctor's prescription as far as I'm aware. People can try it. by going to the company online, and the TMS will need to be prescribed and used in certain doses as the specialists recommend. But they can be very helpful for some people. And the TENS machine, I know that some people have simply gone out and bought it and they find it beneficial, very often in combination with medicines. But there are obviously people who can take no medicines whatsoever, cannot even have triptans or non-steroidal medicines. And if that's their sole treatment, they have reported benefit that makes it a lot less severe, at least.
Okay, thank you. So one of the things I noticed from the comments is some of the high costs. A lot of these kind of alternative and non-drug treatments can be quite expensive. Things like the devices, often the quantity of supplements and things you're buying, some of the different treatments you can try. I wondered if you have any sort of suggestions around that, or any sort of maybe cheaper options or more accessible options for people that maybe can't afford some of the more expensive devices that might help.
Yeah, I think the alternative to the devices really are the medicines, when in terms of cost. Because there isn't a way that I can think of to get around the cost. The usual way is to get into a trial very often at the early stages of device introductions, where they do, they call them post-market studies, where they're approved, they're safe, they're effective according to the research that's done. But very often companies allow patients to use it initially for free on a free of charge scheme before the full price is applied. So, but I'm not aware of any device doing that currently. They were offered, Gammacore was offered, and the TMS was offered on such a scheme in the past, but none that I'm currently aware of. If anyone's linked to a headache specialist clinic, it's always worth asking if there are any similar trials they can get involved in, or whether the particular clinic has any arrangement with any device company to offer it free of charge to patients. Barring that, I don't know if there's a less expensive way. The other thing to say is, if there are less expensive ways outside of those established devices that we know of, and we know of those because they've done studies and been deemed as safe and effective, the less expensive ones that we don't know of, we don't know what the evidence for safety is, so it's difficult to recommend anything that isn't studied carefully.
Agreed. Thank you. There were a couple of questions around triggers and things. So people said sort of, how can you manage sort of chronic migraines in general when you don't know what the trigger is? So they seem to get migraines no matter what they do. Obviously, you've mentioned the diaries, which is very useful, but is there anything else you want to say about that, or any other things that might help them?
Yeah, no, absolutely. That is very true. Sometimes, in spite of all that you do, the migraines continue to be frequent, they continue to be severe. And that tends to happen really if you're managing triggers, or there aren't identified triggers that will change migraine. It's an indication that the migraine process is so active that almost whatever you do yourself, it's not going to produce enough benefit. And the indication for that is a preventive treatment. And that preventive, again, could be a tablet or medicine, a device, or things like acupuncture or supplements. If, however, these migraines have developed this severe, very sensitive stage, and none of these things may be sufficient, so then people start looking at combinations or more aggressive treatments, and then we still have to go to medicines. Just to get a lid on things, at least make them less severe, so that things like trigger management can be more effective. On the other hand, if things are really bad, not responding to trigger management on their own, it's still useful to manage things, because the more irregularity there is, the more you sustain this bad phase of migraine being just troublesome all the time. So we still need to be mindful of avoiding triggers, and if they're not known, just regularity is really helpful to maintain that. We know that sleep and stress are probably the two most common migraine triggers or aggravators. So if sleep patterns were irregular, for example, just correcting that may not be enough on its own, but it could, by the sleep continuing to be irregular, can just cause attacks to last that much longer or be more severe for longer. So, but I take it it's absolutely true that once it gets past a certain stage, trigger management on its own or lifestyle management is just often not enough.
Thank you. So a few more questions that sort of focus on the non-drug treatment things that we'll go through. So the first one's asking, is there any evidence around the efficiency of cold water swimming for a migraine that you know of?
Yeah, I've read a bit about this. Well, I've seen a lot about it. The idea behind the cold water swimming is reducing inflammation. I think that's the way they say it works. Now, does reducing inflammation indirectly help migraine, help general health, help our bodies fight other things better? So, for example, if we try to promote our own endorphins with exercise, which is pain killing, would things like cold water swimming, in effect, give our own systems a better chance to fight pain itself? Possibly, but I can't make a statement on its direct link to migraine. But it's seen as a very healthy thing to do. So
yeah,
maybe
well,
worth
thank
trying.
you. Yeah. Another question. So you've mentioned about acupuncture being helpful. A couple of people suggest it has been, or asking around chiropractic and osteopath treatments and asking if they're any good for people with migraine.
It's a tricky one because it comes with risks. Obviously, with migraine, you get a lot of neck and shoulder stiffness. And for many people, that in itself can trigger another migraine. So in theory, you'd think if you had osteopathic or chiropractic treatment, that might relieve some of that tightness and just prevent further migraines. However, there are also associated risks with things like neck treatment, where you could have there's been reported carotid dissection, so a little injury to the delicate vessels in the neck, which can cause bleeds. Isolated incidents, but for the risk, it's not recommended for those sorts of reasons, because the risk of having such injuries would not outweigh any benefit you'd have for migraine, relief of neck and shoulder stiffness. So instead, maybe gentle exercises, stretches, keeping the neck and shoulders loose through certain exercises might be preferable. And I know that many osteopaths and chiropractors say they regularly treat migraines, but I don't know what they actually do, and we don't know how many people have not so beneficial effects. So it's difficult to recommend it.
Yeah, definitely. Sort of leaning on to that, because you just mentioned exercise, and I know you've talked about the benefits of that. Someone says they really struggle with exercising with their migraines, and asked if there's any sort of specific activities or exercise you would recommend that wouldn't worsen. I know it can vary person to person. Someone suggested Pilates. I don't know if you have any other suggestions or any comments.
I think the more starting with something very gentle, like just walking, can be a good test of whether exercise is going to be helpful. So gentle yoga, Pilates, things that don't involve sudden movements tend to be better, because very often find things with impact can really aggravate migraine. So running and stuff like that might be a little bit too aggressive, at least initially. And the other thing about exercise is to really remain well hydrated So dehydration wouldn't, a combination of dehydration and excess and movement wouldn't aggravate or bring on an attack. Yeah, I think walking is probably, and yoga, Pilates are probably quite gentle. And then even so, being careful with building up. It's always good to start with little and build up, or slower and then build up to just so the body gets used to it, because the migraine brain just doesn't react well to change and sudden change. So we need to just adapt, do things more gently.
Yeah, definitely. And lots of lovely comments coming in now of people saying that yoga and Pilates has really helped their body and themselves relax, and it's really helped as well. So that's really great to hear. Just a couple, one more then. So we've got, someone's asking if there's any advice on preventing migraine triggered by travel.
Actually, that's a good one, actually. Yes, drinking lots of fluid, having a good night's sleep. Altitude, if they're meant, if travel involves flying, then altitude can be a trigger for some people. People who use medicines, often we say take your medicine and take it as soon as you notice the earliest sign of migraine symptoms when flying. But non-medicine options would be good sleep and rest, well hydrated, and not skipping meals.
Definitely. Yeah, thank you. Okay, I think we'll just do one more, having looked at the time. We do have loads and loads of really great questions about drug treatments and things like that, but obviously with this being a talk on non-drug, if anyone wants to send those questions to him afterwards. But yeah, so the last question, it's come up a couple of times, is your comments about homeopathy, whether you think this is beneficial, whether you have any sort of suggestions or anything around that.
I don't have any experience with using homeopathy. We've never recommended it in clinics. So I think when there's the absence of evidence, we simply don't use it. So it doesn't mean that it may not be helpful, but I have no experience with it.
No worries. Thank you. That's really great. Thanks, Ria.
Okay, that's great. That's excellent. Thanks both of you for the really interesting Q&A session. I think there's some excellent questions being asked, actually. So we would just like to advise that we do have a number of toolkits available on our website as well, which can be downloaded. So these cover migraine in the workplace, migraine in schools, migraine in further and higher education, and also welfare benefits that people may be entitled to as well. But if I could just thank everyone again for coming today. Hopefully we got through most of the questions, but as we have said, if you do have any that you do wish to ask, please do send those over to the helpline and we can get those answered and get back to you as soon as possible on those. So you will shortly have an evaluation survey coming out to you via email. If you could complete that for us, it only takes a couple of minutes. It just gives us a bit of scope on where to go next with these events and any feedback that you might have. But yep, so that's the end of the event, and thank you again for coming, and thank you so much, Ria. It was really useful.
Very welcome. Thanks to all for joining. Bye.